Welcome to Wax Off. My name is Robina Rayasat and I'm a hearing aid audiologist. I'll be talking through our earwax removal videos, so let's see some wax. This patient, let's call him Prince Oberyn Martel. Prince Oberyn Martel is a very unusual case. I get to see him every 8 months because his ears block up really quickly because of the unusually thick, wiry hairs he has in his ears. Before he came to see me, he would go to the local ENT hospital to have the wax blockages removed, as they were the only place that could really handle the type of wax he has. So get ready for a very long procedure on this episode. It really deserves 2 episodes, but I have squeezed into one, and warning, if you don't like hairy ears, it's time to look away now. So I started with his right ear. Immediately you can see that the wax is quite soft, but not due to over-oiling. The oil that you're seeing in this part of the procedure was put in right before the procedure started. And I do ask Prince Oberyn not to oil the night before like we would usually recommend to other patients, because the blockage can become a real sticky mess. And we worked out that if I oil just prior to the procedure, this is the best for his type of wax. Lots of thicker hairs in the ear canal, which are preventing the wax from coming out in one go. And because of the sheer number of hairs stuck in the wax, you can see that the suction probe isn't quite holding on to the plug of wax very well. It's moving, but it's not coming out. So I'm doing a wiggling motion here. And you can almost see that if the hairs weren't stuck in this plug of wax, it would have come out by now. With the wiggling motion, I'm trying to get to the deeper part of the wax to come closer to the entrance of the ear canal, almost flipping it upside down. And hopefully this will give some leverage for the plug to come out. But every time I get to the smoother part of the wax to increase the suction, the hairs simply get in the way, which breaks the suction seal of the probe. So I've adjusted my brace of the equipment and I've gone back in. And I could cut the hairs at this stage, but I would rather remove the blockage and then cut the hairs. Otherwise it really does become a waxy, sticky mess. I'm almost using the tip of the probe as a hook to pull the thicker hairs to the entrance of the ear canal. And it's working somewhat, bits are coming away there. And now that those hairs are out of the way, suddenly we get some suction on the main part of the blockage. And the first part of the plug has been removed. You can see it's quite smooth on one side, but it still does have some of those thick, wiry hairs embedded in it. And here is a shot from the other side. Now that the main part of the blockage has come out, you can see that little bits are starting to come away, and here's another piece. This is quite a hairy piece. And there's a view from the other angle. I'm back in now and aiming the probe for the remnant wax. And again, that's come away really nicely. It's almost matted. And some pieces a little bit deeper down, which have come away. Now I'm really going to try to work on this area, which is at the entrance of the ear canal. And this is the part that the wax really does tend to get stuck in. So I have to make sure that this part is as clear as possible to stop it from building up earlier than 8 months. Now here I have adjusted the focus on the endoscope so we can see those hairs and the entrance of the ear canal a bit better with the procedure. We're going back into that area at the entrance of the ear canal. A small piece of keratin here which didn't want to come off, so we will leave that. So why do some people have more hairs in their ears than others? The long wiry hairs that you're seeing in this particular video are called tragus hairs. They are thick wiry hairs that sprout from the tragus or the entrance part of the ear canal, which are very different from the softer hairs inside the ear canal or the rest of the body, which can sometimes be described as peach fuzz. Generally, having hair in the ears isn't a problem. It's perfectly normal and it's seen especially in older men. But it can crowd and clog the ear, making the ear canal more susceptible to infections, especially swimmers, as water gets stuck in the ear canal. South Asian men are more susceptible to growing this type of ear hair, and according to the Guinness World Records book, the longest ear hair recorded in the world belongs to a gentleman from India called Victor Anthony, and it measured just over 7 inches long. So it can actually grow pretty long. Mid-procedure view to see what's going on deeper down. And I'm going to get those little bits that are just in front of the eardrum. So there's lots of oil there, but you can see it comes away. Now here comes a part of the procedure that I don't usually do. I am going to tackle those outer hairs with a pair of micro scissors. This is a very delicate part of the procedure, and I'm almost doing a few at a time in the deeper regions. When we get to the outer regions like here, you can see that I can cut off quite a few at a time, but I've got to be super careful as we're going into those deeper regions. You can appreciate just how thick some of those hairs are at the entrance to the ear canal when you see the view from here. And I'm going to suction up some of those cut hairs because I don't want them to fall deeper down into the ear canal. I could use a Jobson's horn probe here or a rounded instrument to kind of scrape out the hairs, but this works quite well. This device is a rosin inserter and it's almost like a hook which is allowing me to pull out those big hairs closer to the eardrum so that they can be cut off more easily. Few more bits of tidying up here with the suction probe and almost hooking those hairs so that they come out of the ear canal. And I have speeded things up here because it's much of the same thing, trying to get those hairs out using the suction probe and cutting at the same time as well. So all of this has been sped up for you. And here is the final shot of the right ear. A little bit red as usual, a little bit of oil on the actual eardrum, and still some hairs there. We will never be able to get rid of all of those, but I am very happy with that procedure. That has felt really good for Prince Oberyn Martell. He feels the pressure has been lifted from his ear and he can now hear better with his hearing aid. Now on to the left side. No pre-oiled shot on this side. This view you're seeing here is after the oiling. Again, quite a lot of hairs, but this ear doesn't get blocked up just as much as the right ear. The right ear is the one that's problematic. So I've gone straight to the edge of the blockage here, checking to see which part of the blockage is willing to come out first. And a little bit coming away here, but nothing very spectacular. Back in and suctioning in a different area around the edge, trying to tease away a part that will come away, and there we have it. That's the area that's going to get us the blockage out. You can see it's coming away from the ear canal wall and it's allowed us to get some movement of the plug, but it is stuck somewhere. And there we go, it's come to the surface of the entrance here. Not quite letting go of it, the ear, but we're nearly there. It's quite a sizable plug as well. I've almost moved the blockage around in the ear canal. And here it is, finally the sizable earplug. Very matted with a lot of the hairs that have fallen off into the ear canal. And here is another freeze frame from the other side. So some residual wax and keratin layers in the outer part of the ear canal where the hairs are, which are all coming away relatively easily. And a little skin pull here, together with hairs. Because this was making a lot of noise inside the ear, I decided to go for the top area because there's a lot hiding up there. And this particular piece here that you're seeing on screen right now was causing a huge amount of clarinetting. So I've added a fine tip on the end to remove that bit without it being so loud. Now I'm tackling the area which is at the roof of the ear canal. And you can see that the longer hairs have created almost a similar shape to the ear canal itself, rounded. And that's because the larger hairs have almost curved into the shape of the entrance of the ear canal as Prince Oberyn wears his hearing devices. So as he's putting the devices in, it's kind of flattening the hairs in that area and pushes the large hairs into the shape of the entrance of the ear canal, and that's why you're getting that there. And sometimes as I'm going in with the probe, it's still got hairs stuck in it, or it's picking up hairs on the entrance to the ear canal. But I'm trying to get that little bit just at the deeper part of the ear canal there, and that comes away. This type of procedure, you have to deal with it kind of in small little chunks because you'll never get everything out. And obviously you want to make it comfortable for Prince Martell as well. And at the same time, I've got to take out enough of the wax so it doesn't build up so quickly again, to basically ensure that the patient isn't coming back so regularly for these procedures. So dealing with the entrance of his ear canal again, which is vitally important to ensure that the future blockages are minimised. And we are almost done with this procedure, which took long, but it was worth it. So I finished up this procedure by cutting some of the entrance of the ear canal hairs to give the wax and the migration process some space to move around in, and for the hearing device to fit better as well, so it creates more of a seal in the ear canal. So here is the final shot of the left ear. You can see it's pretty red looking. The capillaries on the eardrum, or the blood supply, is very visible. That will start to die down within the next few hours, and within a day the eardrum will start to look more of a normal mother of pearl type colour. So thank you so much for watching episode 27 of Wax Off. Hit the notification bell for alerts when we upload new videos every week so you don't miss out, and I will see you in the next one.